welcome. The food is pretty spectacular, wasn't it? I mean, I think this is what's so great about food is we were able to come together and have this spectacular meal and realize that a plant-based diet doesn't have to be boring. It can be actually delicious. We're all full, and we feel great, and we have a great conversation about it too. So that's the joy about food. And what's been amazing working on this report for the past 3 years is the overwhelming reaction we've gotten to it. You know, when we first started this, probably 4 years ago, a few of us got together and we looked at the literature and we said, what's missing? We realized that there was no scientific targets out there for what defined a healthy and sustainable diet. And there's so much confusion out there about what a healthy diet is. And I think if I was to go around here and ask you what is a healthy diet, we'd get extremely different reactions. So number one, what is a healthy diet? There was not consensus on that, right? Then over here, what is a sustainable diet? People call their food sustainable, but what does that actually mean? So we looked and said, well, there's a huge hole here, and if we don't know where we're going, if we don't have the actual targets about where we have to head, it's going to be really hard to get there. And when you look at food, it's the primary cause of biodiversity loss, water use, greenhouse gas emissions, nitrogen, phosphorus pollution, so many ills that we see in the world. It's also the cause of so many health ills that we have. But there are no targets telling us where we have to go. So we said, well, we have to set these targets. We have to go out there and figure out and bring some kind of scientific consensus as to what these targets actually are. So we set out on this journey. We said, well, this is going to take us 12 months to do this. We got 37 of the best minds on the planet to work on this. 12 months easy, right? Well, 3 years later, we finally got it done. And we could not have anticipated the monumental task that we were on to do this. It was an overwhelmingly large thing to do. And still, there's so much work that has to be done. You know, we've had over 7,000 articles written about this thing. We've launched it so far in, I think, 15 countries. We've got another 30 countries left that we're going to launch this in. And I think what's so cool about it is it just shows you the power of food. You know, we're all sitting around tables. We're having conversations around food. Great talks. We fall in love over food. We go out for dinner. We have conversations. I mean, food is one of those things that binds us. So it's such a huge opportunity, but it's also one of the greatest ills that we have today. It's got this huge potential for creating bad things. It's bad for people, can be bad for planet, but it also has this potential for solving all these problems that we see up here. And food really connects all of these together. So what I'm going to talk about for the next 40 minutes, 30 minutes, we'll see, is food and the scientific targets that we've set. And I'll describe to you a little bit about the report that we've been working on for the last 3 years. Now, Courtney's going to give me a hard time for this first slide. This is a New York Times article a couple weeks ago that I think is pretty important that we take to heart. It is time to panic. If there's ever a time to panic and say, this is a time for us to get down to business, it's now. Because we are really absolutely running out of time. This is just focusing on climate change. And the climate around the world is absolutely crazy right now. I know that you guys had a very cold winter here. But in Sweden, you know, in February, the average temperature is about 8 degrees. It's supposed to be -2. You know, we were up to 10 to 12 degrees some days. In the UK, just about a week and a half ago, it was more than 20 degrees. People were out surfing. I mean, the climate is changing in ways that scientists predicted, but it was the worst case scenario that they're actually predicting. You know, if there's ever a chance for, or if there's ever a time not to be patient, it's now. Because if we're not going to solve this thing, I mean, we only have 11 years left to solve these. 31 years left to solve the Paris Climate Agreement. And the thing about it is, you know, dear friends, we have agreed to accomplish this. We have said as a community, we're going to solve the Sustainable Development Goals. Now, it's one thing to say, let's come together and do this thing. It's another thing to figure out how do we actually do it. Well, 4 years have gone by since we signed the agreement to do this. We only have 11 years left. Why are we waiting to get this done? We're still waiting to try and figure out how to solve these targets. What are the targets for doing this? Who else is better positioned to advance this than a university such as this that's looking to promote a planetary health program that ties all of this stuff together? If not you guys, who else is going to do it, right? Let's not wait for somebody else to do it. 11 years left. Paris Climate Change Agreement. We signed it a few years ago. That's great. It's taken us 4 years to figure out, to go from the signing to actually saying, how do we actually do this thing? It's only 31 years left to do this, and I'll show you the pace and the scale that we have to solve this in pretty quickly, but it's pretty astounding, the monumental task that we have, that we're facing. You know, after World War II, people came on board. We were able to solve huge global problems. Big institutions were organized and formed to solve these things. We need that same kind of wartime mentality right now, because that's the same kind of crisis that we're facing. But let's talk a little bit about what the problem is and what food has to do with it. Well, this is from the Rockefeller Commission on Planetary Health. And if you look at almost any environmental variable out there, you see the same kind of hockey stick type pattern. And you've got climate change increasing after 1950, shoop, way up there. I think it was just measured, parts per million in terms of greenhouse gas emissions is at 413 parts per million. 400 parts per million was this magical threshold that we never wanted to cross. Now we're at 413, and it's going faster. Keeps on getting faster and faster. Energy use, same thing. Too fast. Right here, tropical forest loss. I worked in Borneo. I would leave, come back 2-3 weeks later, whole forests were gone. It's hard to even tell you or relate to you how fast tropical forests are being lost. So all of these are showing that we cannot continue this exponential energy or this exponential growth in all these environmental variables. I mean, at one time we thought, you know, we're just human species. Doesn't matter. It's a big planet. We can keep on doing whatever we want to it, but we're finally realizing that we have finite resources. And at some point, we have to figure out, how do we start bending these curves? We can't continue to keep on going up like this. We have to figure out, how do we start bending these? We're not there yet, but it has to happen quickly. From a health standpoint, the scale is just as monumental. You know, 821 million people are hungry, go to bed hungry every single night. I think 2017 was the first year that we saw an increase in hunger, actually globally, mainly a result of climate change and all the crises that are going on. 821 million people still do not have enough to eat. On the other side of that, more than 2 billion people are overweight, and they're facing problems of NCDs related with that, whether it's increasing rates of cardiovascular disease, type 2 diabetes, certain types of cancers. That's more than half of the global population that are suffering some form of malnourishment. Why is it that we can accept that half the world either eats too much or not enough? So the scale is monumental. So what did we do? So a number of years ago we said, well, how do we solve this? What is the big question? And the big question that we try to solve is, how are we going to feed every single person on this planet a healthy and sustainable diet? And it's not just, and I think what's a bit different about what we said is not just feed everybody calories, but it's feed every single person a healthy and sustainable diet by 2050. Now, the matter of the fact is by 2050, we're going to put another 2 billion people on the planet. Population control is the elephant in the room that we have to address. But even if we try and address that today, we're still going to put 2 billion more people on this planet. So how do we feed 10 billion people on this planet a healthy and sustainable diet? That was a big question that we tried to answer. Now, how did we do it? 4 different things. First was, number one, we had to define or set scientific targets for what is a healthy diet. We had to bring scientific consensus to this. Just like the IPCC came together and over 20 years said, how much greenhouse gas emissions can we put out there? We said we have to bring the same kind of scientific consensus for what defines a healthy diet. So we use lots of different types of studies for defining that. Now the thing which is extremely important to remember here is that when we set the healthy diet, we did not factor in the environment. We only said that us as a biological species, what do we need to optimize our health, period. The healthy diet is only focused on health. Some reports out there will say, well, we've got greenhouse gas emissions, climate change, Paris, we've got to meet all those things. What should we be eating to achieve those environmental goals? We did not want to consider the environment here. We put a firewall there and we said, what do we need to eat if we want to be healthy? Decrease our risk for all these bad things that we're facing. Second thing we did is we had to define the planetary boundaries for what is the environmental impact that we could put out there. How much greenhouse gas emissions could come from food? How much nitrogen and phosphorus pollution, fertilizer pollution could come from food? How much biodiversity can we tolerate to be lost? How much water can be used? How much land can be used? What are the global limits for these things right here? Then what we said is, well, now that we've got the healthy diet, we've got the environmental limits, can we achieve the healthy diet for every single person within these environmental limits? Could we bring those two together? Can we marry those things? Is it actually possible? That was the modeling that we did. And then the last thing we said is, what are the high-level policy implications of this? Now, once again, it's important to remember that these are global targets. They're not local targets. How you achieve this in Saskatchewan, how you achieve this in Ethiopia, how you achieve this in Indonesia, it's going to look extremely different. But it was impossible for us to produce a report for 190 plus countries in the world with specific policy recommendations. That's just not possible. So we set the global targets, just like Paris set the global limits for carbon dioxide emissions. Now it's the work of you guys to figure out what that means for here and what that means for the local communities, the province, or even the country moving forward. So let's look at the first scientific target, which is for healthy diets. We just ate it. But let's step back from the more tangible action side of eating it, and let's look at what it means from a number standpoint, okay? All right, so what we did is we used a food group approach, which is what most people are going towards right now, away from a nutrient-based approach. Broken up into the major food groups: whole grains, starchy vegetables, fruits, dairy foods, protein sources, added fats, sugars. We set a daily intake per day of grams per day that you should be eating, and we set the ranges and the daily caloric intake right here. Now, important to note here, the reason that we had to set a daily intake, and people get really hung up on these numbers, how do you know it's 232 grams of whole grains? Well, we don't. That's our best estimate that we could come up with, but if you're going to model something, you have to give it a number. It's important to also make sure that we've also included this range. So for starchy vegetables, sure, the daily intake is 50 grams per day, which is a single potato per day, but the range is 0 to 100. So anywhere from no potatoes to 2 potatoes. But don't get hung up on the numbers, okay? Let's not debate the details. It's the general large trends that we need to keep focused on here, okay? So I think if you look at the vegetables and fruits, 300 grams per day of vegetables, fruits 200 grams per day, range of 200 to 600 for veggies, 100 to 300 for fruits. It's pretty in line with most international recommendations. Essentially, eat a lot of them, right? Fruits and veggies are good for you. After about 600 grams and 300 grams of fruits, you don't really need a whole lot in terms of benefits. Like the more fruits and vegetables you eat doesn't keep on giving you benefits. It tends to taper off. So it seems like the optimal range here is about 300 grams per day of veggies and about 200 grams per day of fruits. Dairy, 250 grams per day. That's a single serving of dairy per day. Now, I live in Sweden. I think the average daily consumption is 1 kilogram per day of dairy. That's yogurts, that's milks, that's cheeses. Most people eat a lot more than this. We're saying from an optimal intake, and we balance all the nutrients, a single serving seems to make sense. And the thing also that you have to consider about this is the daily caloric intake is 2,500 kilocalories. So you need to think about balancing this. So the more that you eat of something, the less that you're going to eat of something else. So if you increase your potato intake of eating 3 or 4 times that, I think a single potato has about 130 calories, I believe. That means that you're going to have to eat less of something else. So it's all this great balancing act to make sure that you're staying within this daily caloric range. Now, this is where things get a bit controversial, is the protein sources. And this seems to be where most of the debate happens, is what from a protein source should we be eating? Now, once again, this is based on health. It's not based on the environment. Beef, lamb, and pork, red meat, 14 grams per day, 100 grams per week. That's a single serving of red meat per week. Seems to be, from the research, the amount of red meat you should having to minimize your risks for certain types of diseases. A single serving per week. Chicken and other poultry, 29 grams per day, about a serving and a half per week, more or less. Eggs, 13 grams per day, which is about 1.5 eggs per week. I think a lot of us are way over that. Fish, 28 grams, about a serving and a half. So we're looking at about 4 servings of animal source foods per week. So those of us that are saying this is a vegan diet, absolutely not. Vegetarian diet, absolutely not. This is an omnivore diet. But what we're saying with this is instead of putting meat at the center of our plate, which many of us do, we're saying put it to the side. Use it as something that is a condiment. Now, I love lobster, but I'm not going to eat lobster every single day. I consider lobster as being one of those treats. Same thing with red meat. We should have that same type of thinking here. Yeah, I love red meat, but I'm not going to eat it every single day. It becomes a treat. Maybe you have it once a week. And purely, once again, this is from a health standpoint. A lot of unsaturated oils. A lot of unsaturated oils. And lastly, sugars. About 5% of your total caloric intake should come from sugars. About 10% we see harm, and about 5% we don't. 10% is a single cola. You have 1 cola per day, you've already exceeded your daily caloric intake of sugars. So 31 grams is not that much, but actually going down more towards the 0 range is probably better. So, wow. All right, so what does this look like on a plate? Here's what it looks like. So those of us that just ate a plate of food, it sort of looks like this. We're saying half our plate has to be fruits and veggies. Whole grains, almost a quarter of our plate. Starchy vegetables, hardly any starchy vegetables at all. Dairy foods, animal source proteins, a little bit, and a lot of plant-based foods right here. That's where the majority of our proteins have to come from. This dotted line right here is a 2,500 kilocalorie mark, so we're saying we need to be eating that amount. Now, we get this all the time. Oh, that's so boring. This diet is so restrictive, but it's not. And the thing about this diet is, as you just saw today, by the food that we ate, it's absolutely beautiful. It's delicious. It's amazing. This is what it looks like. And it doesn't matter if you live in India or the Okinawan diet or the Mediterranean diet. This diet really follows so many diets out there. We are not proposing a new diet. This is not some kind of groundbreaking new diet that we just came up with. This is what people have been eating for a really long time. It's just been the modern shift that we've had away from this particular type of eating habits towards saying, well, no, animal source foods are the best. If we're going through this nutrition transition, we have to eat animal source foods. That is a new type of thinking that we've been going towards. If you talk to your grandparents, they'd probably say, yeah, no, we didn't have meat every day. We had it once a week. The Mediterranean diet is essentially what we're showing up here. Kudos to Canada. The food guide just came out in January, a few days after we launched this report. It looks very similar to the plate that we also launched. I think the Canadian food guide, and believe me, people around the world are talking about the Canadian food guide. People are saying, like, wow, Canada was bold enough to come up with this. The cool thing about the Canadian Food Guide is it looks very similar to the diet that we came up with, the Planetary Health Diet. We had 37 scientists independently working on this for 3 years. Canada had 37 scientists working on this independently with no industry influence, and we came up with essentially the same results. Half your plate, fruits and veggies, whole grains, and plant-based foods. And look at what they have up here that you should be drinking, is water. Now I know that there's a lot of discussion here about not having dairy up there, but let's talk. So, yeah, I just think this is so cool. I think I'm so proud of Canada for taking this step. Not only for Canadians, but for the world. Because I think people are so cautious when they launch something like this. And Canada was able to put something forward that actually pushes the world in a really cool direction. So how close are we to this? This 100% right here is the edge of the plate. If we are eating the 2,500 kilocalorie diet, for each one of the food groups right here, from red meats all the way down to nuts, we should be eating up to the edge of that boundary. So that boundary is where we should be going. Over it is bad, under it is bad. Look at red meat from a North American perspective, 638% above. We had to cut the wedge because it was so far above we couldn't even keep it to scale. Starchy vegetables, way too much potato chips and French fries, I think. Eggs and chicken and all the animal source proteins. We love animal source proteins. And look at the good stuff. We're so far under consuming that. And if you look at nuts, I mean, we're thinking about how we're going to represent this. You can't even get it on there. It's right there, though. So this is North America. Now contrast this with other parts of the world, and it's shocking. Sub-Saharan Africa. The main, right here, is starchy vegetables. Things like cassava. You can grow it, it fills your belly, but it doesn't provide the nutrition that we need. So lots and lots of starchy vegetables. And underconsumption of a lot of things right there. Way too much underconsumption of the good stuff. South Asia. India and that part of the world, Pakistan, Bangladesh, they're under-consuming almost everything. And I think what's contrasting about this is it shows you that what is happening in the world today, it really highlights the fact that in some parts of the world we're eating way too much, and in other parts of the world we're eating way too little. And the only way that we're going to be able to solve this problem, I'm pointing to SDG 17 right there, and well, actually all of them. Some parts of the world are going to have to give up. Some parts of the world are going to have to eat more. We're not saying everybody in the world needs to eat less. We have to start doing this. And we've got it pretty good here. Come on. In Sweden, where I live, we've got it pretty good. I'm happy to give up eating red meat for a few days of the week, if that means that other parts of the world can eat more. And we have to start thinking this contract and converge type policy, type of intervention. That's the only way that we're going to be able to solve this. So, hot off the press, what's going on in Canada? This is Canadian consumption data in terms of how you compare with everybody else. So this is the flexitarian diet, which is a planetary health diet that we came up with. Pescatarian diet, vegan diet, vegetarian diet. Let's look at just percent changes. So if you look at legumes, if you want to consume up to the planetary health diet, Canadians have to eat at 251% more legumes. We're not eating nearly enough legumes. 251% more for pescatarian and vegan, and if you want to go vegan, it's 493% more legumes. So you can see we're not eating nearly enough of the good stuff. 58% increase in vegetables. Fruits, we're doing pretty good with fruits, but you can see that we have to start eating more of that stuff. And this is where I think Saskatchewan can start producing more of this and feed the world. But look at what's going on with sugar, 60% reduction. Sugar consumption, 90% reduction in beef and pork, 70% reduction in poultry, 47% for dairy, and 49% for eggs. Once again, Canadians are eating more red meats than Americans, is what it looks like, and we need a huge transition away from these animal source foods towards these plant source foods. What's this going to do? Why should we do it? From a health perspective, and I think this is where people listen to, we can actually save 11 million lives per year. by shifting to this diet. 11 million lives per year. We used 3 different modeling approaches to look at this, and they all came out to relatively the same number, 11 million lives saved globally. In Canada, how many lives can we save if we did this? So once again, flexitarian diet, vegetarian, pescatarian, and vegan diets. This is avoided deaths in the thousands. Approximately 70,000 deaths in Canada per year we can save by adopting the Planetary Health diet, with the main risk factor being obesity, reduction in obesity within Canada. These are the other risk factors that you can see right here. 70,000 lives we can save. So that's the health aspect of it. Let's talk about sustainable food. It's a little bit harder to recognize, but what we did is we said, well, these are the main Earth system processes that we need to look at. How much climate change or greenhouse gas emissions, land that we can use, fresh water we can use, fertilizer we can use, biodiversity we can lose. And we set global targets. Once again, same thing to the Paris Climate Agreement, the global targets. We set globally how much can we put out there. These numbers probably don't make a lot of sense, but I'll walk you through a few of them here. Land system change, though, what we're saying is we are using approximately 40% of the land on this planet. We can't convert anymore. We're saying that this number right here has to remain constant. There's no more land that we have to use for agriculture. So we need to figure out how to produce food for 2 billion more people and do it on the land that we have. This right here, biodiversity loss, we are so far off the charts in terms of biodiversity that we're losing. We have to figure out somehow how to actually get this one under control. Now the thing about this is, we tend to focus on one of them. We tend to say, well, let's just focus on greenhouse gas emissions and call it sustainable. We absolutely have to move beyond that. And if we're talking about planetary health, all of these systems are connected. We might achieve Paris, but if we don't achieve, if we lose on biodiversity, we lose on everything else. If we lose on water, we lose on everything else. Every single one of these is absolutely connected. Now let's look at the climate change a little bit, just to give you an indication of the pace and the scale that we're talking about. Here is gigatons of CO2 equivalents up here on the x-axis. We're sitting at 2019, we're sitting at about 45 to 47 gigatons that we're emitting globally. This is years, 2050 here, 2100 here. This is the positive, this is negative emissions right here. So what we're saying is that by 2020, 1 year, well, it's March, we're looking at about 10 months, we have to peak carbon dioxide emissions globally. After 2020, carbon dioxide emissions have to drastically reduce. By 2050, where they almost have to be zero. So this gray right here is CO2. This red right here is methane, and this right here is nitrous oxide. The red and the orange, or the red and yellow, come from agriculture. This comes from everything else. So we need to figure out how to rapidly decarbonize the global economy and do it extremely fast. In the EAT-Lancet report, we didn't worry about this gray stuff. What we said is, let's just worry about this methane and nitrous oxide emissions. And if you can see here, consistent, we set it at about 5 gigatons. We're saying that methane and nitrous oxide emissions coming from agriculture needs to stay a constant from now onward at about 5 gigatons moving forward. We could go as low as maybe 1 gigaton or 2 gigatons, but we can't do that because we need to figure out how to feed every single person on this planet food. We set it higher, which means that this bit right here has to come down a lot faster. Now, the elephant in the room here also that nobody wants to talk about is the fact that this negative portion down here, we've got to figure out how to pull carbon dioxide out of the atmosphere. We will not achieve SDG 13 without pulling a lot of carbon dioxide out and storing it in the ground. And you know what one of the best carbon sinks there is out there? Agriculture, how we produce food. If we do it right, we can actually store a lot of the carbon dioxide out, sink it, store it, which will solve Paris. Environmental benefits. Well, if you look at this, this is change in resource demand for adopting the flexitarian diet. Essentially, if you add up all of the boundaries that we look at, we're looking at about approximately a 200% reduction in total environmental benefits across boundaries that we're looking at if you adopt this planetary health diet. So huge environmental impacts from a positive side if we shift our diets. So can we actually achieve it for 10 billion people? This is a $1 million question, right? So what we did is, first of all, we set 3 different actions. The first action is dietary shift. Let's shift everybody on the planet towards a planetary health diet, what I outlined before. The second action that we looked at, about if it's actually possible to do it, is we need to reduce our waste. And we need to reduce waste by half. There's a great report which just came out about 3 or 4 weeks ago in Canada that said $31 billion is wasted in Canada. Almost 58% of all food in Canada is wasted. How can we tolerate that? So we said, well, let's just figure out how to reduce it by half, in line with SDG target 12.3. And then the third action that we said, well, let's just look at and see what kind of impact this has, is production standpoint. We modeled, well, a standard level of ambition in terms of closing yield gaps, doing better with water, doing better with nitrogen and phosphorus. And then we also modeled really improved production practices, which means 90% closing of yield gap, 30% increase in N&P efficiency, and all the other ones. This is going to be a bit easier to achieve. This is going to be harder, the production plus. So here's the results. Looks complicated. There's a lot of really rich information, and I'll just walk you through a little bit of it, and I think during Q&A we can kind of extract some of this if you guys have some more questions about this. So what we did, we've got the 3 actions here: production, business as usual, change in production practices, medium ambition, and high ambition. Waste, we have full waste, which is we don't do anything about it, and we have half waste, which is cutting it by half, which was the action that we set. Diet is business as usual, means we don't do anything, and the other one is dietary shift, means we shift towards a planetary health diet. So we modeled these 3 actions right here and the impact that they would have. These are the boundaries that we set for each one of the environmental boundaries that we have right here. This is where we are in 2010, the baseline year. You can see we're over here. Red is bad, yellow is within uncertainty, and green is good. So essentially we want to be all within green, but yellow works. We're doing okay for cropland use and water use globally. Water is really a regional problem. Nitrogen, phosphorus, and biodiversity we're not doing very good at as of 2010. Now look at this. So this is 2050. Let's say we don't do anything we don't change the way that we produce food. We continue to waste globally like we have been, and we don't change our diets. All across the board, we're in big trouble. Greenhouse gas emissions almost double, from 5.2 up to 9.8 gigatons. And the wiggle room that we have, if you think about that transition pathway that I showed you, is so small, it'll be impossible for us to achieve Paris if we double emissions. Cropland use, we almost double in terms of cropland use globally. And where is most of that going to come from? Borneo, the Congo, and Brazil, these high biodiversity areas. So we double cropland use, that puts biodiversity loss off the charts, way off the charts. Our limit is 10, this is 1,043. I mean, we can't even graph this, it's so far off the charts. Nitrogen and phosphorus pollution, fertilizer use, off the charts. Now, what happens as we start to adopt, increase, or better production practices, better waste, and a shift of our diets? You'll see as we move down the table, we get greener and more yellower. Until we get to the bottom line here where we say, well, we increase our production practices, we do things better here, we have our waste, and we shift our diets, and there we go, we've achieved it. Every single target is within the ranges that we've set. It's within the green and the yellows. And that proves that we can do it. But you can see here, not by very far. We just squeak under the boundaries. Now, what this shows you is that the wiggle room here that we have for air is so small. And this is a sensitivity analysis that we ran here. Similar chart, but what we said, well, let's say we increase meat consumption from 100 grams per day to 300 grams per day, in line with WHO standards. 100 grams, which we've set, to 300 grams per day. Red meat consumption goes from green to 9, just by marginally increasing red meat consumption. So that shows you the margin of error that we have here is really small. Same for dairy. If we increase consumption of dairy from 250 grams per day, a single serving, to 2 servings per day, we're off the charts on many of these. So we can do it. But if we're going to put 2 billion more people on this planet, we have to be pretty strict in terms of how we do this. And our margin of error is very small. Now, what actions, the 3 actions that we said, dietary shift, change of production practices, and halving waste, how does that impact each one of the environmental variables? And I think this is what is so confusing to people, is they say, well, I'm just going to focus on dietary shift. And if I focus on dietary shift, that's going to save the planet. No, it won't. Or if I'm going to focus on reducing food loss and waste, and that's going to save the planet. No, it won't. Or I'm just going to focus on changing production practices. That's going to save the planet. No, it won't. And let me show you why. So this is 100%. This is the boundary that we've set. Wow, that was fast. Okay, this is a boundary that we've set right here. This right here is the 5 gigatons boundary that we set. We need to be within this dotted line if we want to work within the environmental limits. This is the uncertainty range right here. This is where we're going to be by 2050. If we don't do anything, that business as usual scenario, we don't change anything, we just keep on doing and consuming and producing the way that we are, we're going to be 96% above by 2050. So we need to figure out how to get from here down to here, a reduction of 96%. Well, if we just focus on dietary shift for greenhouse gas emissions, what impact will that have? Pretty huge. A 96% reduction in greenhouse gas emissions. Now, this is a beautiful thing about dietary shift. If you're worried about climate change, change your diet. That's the single greatest action we can have. We can actually get within the boundary for climate change just by shifting the diet to the planetary health diet that we looked at. So that's a good thing about this particular environmental boundary. But look at production practices. If we just focus on production practices, it only has a change of between 18 and 22%. It doesn't even get us close to being within the boundary. If we only focus on food loss and waste, it only reduces it by 12%. So those of you, those individuals that say, well, I'm gonna focus on food loss and waste because it's gonna solve climate change, nope, it won't even get us close. Food loss and waste is an issue that everybody loves to talk about, and it's extremely important. It's one of the main actions that we talked about, but it's easier to talk about food loss and waste than it is to talk about dietary change. Nobody can argue with food loss and waste, but everybody has an opinion about dietary change. But dietary change has the largest impact when you're talking about climate change. Now, what happens if we combine all 3 actions? So we don't just focus on one, we say, let's do them all together. We're way under the boundary. Shoo, way under. Moral of the story, do all 3. So let's look at the other ones. We've got a very colorful chart here, but let's just look at cropland use right here. So remember the target was we have no more cropland, we have to stay where we are. Well, if we only focus on shifting diets, we're way above the boundary right here. Shifting diets is not going to impact the amount of land that we use. We're still going to be over. But change in production practices, that means doing things better, essentially gets us within the boundary. So here is where a change in production practices has a greater impact than shifting diets. And here, having waste doesn't have as great of an impact, but combine them all 3, we're once again below the boundary. Moral of the story, do all three. Now, if you just look at what happens if we combine all three actions, we're either within the boundary for each one of the environmental targets or the uncertainty range. We have to do all three. You can't just focus on one. We have to do all three together. That's the only way that we're going to be able to achieve this. And I think as you're thinking about the SDGs, and the beautiful thing about the SDGs and the development of the Planetary Health Program that you have here, it has to be holistic. There is not a silver bullet. And anybody that tells you that all you have to do is this is wrong. There is no simple answer. We have to do a lot of these things combined. So what are the strategies, the high-level policy strategies to achieve this? Once again, these are global, and I'm not going to get into national specific targets. The first one is we have to seek international and national commitment to actually do this. We have to shift diets. And there's a lot of different ways that we can do this. I think one of the most common ways that we put out there is more the bottom-up approach, which is education campaigns and consumer awareness, and I think that's great, but it's not going to be enough. We also have to do the top-down regulatory measures to actually achieve this. We have to have both of them, the hard policy measures and the soft policy measures. We have to come at it from both angles. And we're getting there. Still a lot of work to do. We have to shift the focus from producing high quantities of food, just quantities, to focus on qualities. And I think this is where the emphasis has been, is it's saying all we have to produce is calories. Okay, we've got 10 billion people. How many calories do we need? Let's produce that. People will be fine. But as you see in places like Africa, you might be able to produce calories from cassava, but it does not mean that people are getting the nutrition that they need. We have to shift away from quantity to quality. Now, what this means in different parts of the world, this right here is percent change between now and 2050. These are the different food groups. This is business as usual, we don't do anything, and the green is adopting the planetary health diet. How would changes in production have to look? Let's look at whole grains, which is where most of the focus is. By if we're going to produce more, we have to produce more whole grains. No, we don't, because we actually don't need an increase in cereal production. We're doing fine. Where we need the increase in production is vegetables, 75% increase by 2050. Fruits, 50%, fish, 50%, legumes, 75%, and nuts, 150% increase. So yes, we do need to decrease away from red meat, producing red meat, to decrease to 65%. But we need to increase all these other areas. So there actually is a huge opportunity here for farmers. Third thing, we have to intensify food. Once again, we don't have any more farmland, so we need to figure out how to produce food for 2 billion more people on the farmland that we have. How do we do this? In some parts of the world, so green is good in terms of looking at yield gaps. Blue is pretty good, so Canada is doing pretty good from a yield gap perspective. We're doing good in terms of producing food. Europe is doing quite good too. But you look at places like Africa, crop yields are way too low. So we need to figure out how in places like Europe and Canada, let's do it more sustainably. Let's do a heck of a lot better job with biodiversity and some of the things like phosphorus pollution. In places like Africa, we need to figure out how do we increase production in Africa. Now, once again, this is not an easy answer. But one of the things that we have to do, especially when you look at soils, is the soils are so nutrient deficient in Africa. And one way to do that is to redistribute the use of fertilizers. America uses way too many fertilizers. You got the Gulf of Mexico, dead zones down there. Europe uses way too many fertilizers. The Baltic Sea is dead. China is using way too many fertilizers. If we could figure out how to redistribute the use of fertilizers and get them to places like Africa that actually need them, crop yields would increase dramatically. Strategy 4, I had to put orangutans in here. We need to figure out how we're going to govern the land and the oceans. This might be one of the trickiest ones. Because in the age where we have to start working together, we're starting to work separate. And countries are starting to nationalize, and countries are starting to look inwards. And we need to figure out how to, once again, achieve SDG 17, which is everybody has to work together. If every single country goes towards a food security standpoint and says, I'm going to produce all the food myself, we're in big trouble. Because places like Nigeria can't produce food themselves. Places like Saudi Arabia can't produce food themselves. We need to figure out how to increase trade and cooperate on this and solve this puzzle together. And that's only going to be done through massive global coordination. Last is have food loss and waste, which I've talked about before. So in conclusion, we've got these great prayer flags up here. I've never seen SDG prayer flags before, but it works beautifully. We won't achieve these, and we won't achieve Paris if we don't transform the food system. We risk failing on both of them. It's a non-negotiable. If we take these seriously, and if we take Paris seriously, we have to take food seriously. And that means a massive global transformation like what we've outlined here. Second is, the only way that we're going to be able to do it is without widespread multi-sector, multi-level action is needed. Once again, SDG 17, we can't do it alone. We can't alienate business. Business has to be part of the solution. Academics have to be part of the solution, but we can't sit here in our ivory towers and talk to each other. We all know what the problem is, and we agree on the problem and that kind of stuff, and that's easy. The hard things, let's get industry in here, let's get policymakers in here, and civil society members, and people that disagree with us, and let's have a conversation about it. The only way that we're going to be able to do it is to work together. And I think that's one of the things you're trying to do with the planetary health agenda, is how do we sit down and have these difficult discussions. We're going to save a lot of lives this way. You know, and when you're talking about advocating for something, this might be the most substantial message you can actually have, is how many lives you're going to save. That and the economics. If somebody can work out the economics of this in terms of what is the true cost of food and do a stern review for the transformation of the food system, that will be huge. What would it cost Canada to shift to this diet? And I know that there's a paper coming out. The Arrow Food Institute is going to be publishing it very shortly, which actually does a cost comparison between the old food guide and the new food guide. And it's surprising. There's a perception out there that eating healthy is expensive. It's not true. It's not true. Second is, what type of world do we want to pass on to our kids? You know, maybe most of us have kids in this room, and I think most of us, I know that myself, I want to leave a world that still has orangutans in it, that still is a pretty cool place to be, you know, and still has biodiversity and fresh water and clean air, and still has healthy people on the planet. You know, so there is an ethical and moral imperative that I think each one of us have to be able to do something like this and be able to pass on a world that we are proud of. And food is absolutely central to that global agenda. So, it's been a great honor to break bread with you and share a meal with you and to share this. And thank you, Cara, and the rest of the team for inviting me here and for being such great hosts. I'll leave it at that. Thank you.
Thanks very much. That was really great to have it all laid out like that. I was interested in your comment on vegetables and nuts, and wondering if you could talk about water and the implications of the water with growing more vegetables and nuts, and the problem that we're going to be faced with water changes, shortages, and extremes.
Yeah, vegetables and nuts are quite interesting because when you look at it from a per weight perspective, the water consumption is so much lower than animal source foods. So when you actually break it down, any way that you do it, the consumption of water is way lower. One of the issues is almonds in California gets a pretty bad rap, and I think there's been a lot of press about that, but that's just because we're growing almonds in a place where there's no water. It doesn't matter if we're growing almonds or if we're growing something else. I mean, there's no water to grow things, you know. So, you know, when you're looking at it and breaking it down per weight, it's growing nuts and vegetables are so much more efficient all the way across the board. So, any modeling that we've done on that says we have more than enough water to do it. We just have to figure out where.
Hi, Brent. Could you talk a little bit about nutrition transition? You mentioned it, and everyone in the room might not be completely aware. But my question was about the role of marketing, because as social creatures, we gravitate towards what everyone else is eating, and I'm sure that many plant-based societies have moved towards a lot more meat just because they see that as what maybe people in the West are eating. So how do we either counter that or take advantage of how we could market this kind of diet, to eat diet?
Yeah, I was talking to my friends back here at this table, and we were talking about this issue, right? In terms of why is it that to eat what you've traditionally been eating, which is a plant-based diet, is considered a poor person's diet? And in so many parts of the world, that's what it is. It's like we eat this plant-based diet, but by eating it because my parents ate it or grandparents ate it, therefore it automatically is poor, and we don't want to be considered poor. So therefore, they eat more animal source foods, and there's the automatic transition towards that. So there's a pretty quick nutrition transition in so many parts of the world of shifting towards more of a Western-based diet, which is high consumption of animal source foods, especially if you look at places like China, where consumption of animal source foods has skyrocketed. And I mean, this is an absolute huge problem globally. I think we should adopt the same thing that we do to cell phones and other sorts of technologies is leapfrogging over those. So these countries are entering into this, and you're getting rising rates of diabetes, type 2 diabetes, and China and India are the two highest countries in the world. And that purely comes from the rapid shift in diets. Now, marketing, the cool thing about it is we can reverse engineer exactly what the great marketing people did post-1950. If you look at Coca-Cola and you look at McDonald's and you look at these other industries, they have made junk food sexy. You watch these things, you watch the Super Bowl down in the U.S., and it's all junk food. And you get this idea, it's like, oh, I got to eat this. This is cool. If I eat this, I will look better, and I will feel better, and I will be able to, wow. And we can do the same thing. We just have to make healthy food sexy. And it's as simple as marketing. And you need bold leaders like the mayor of London, which just banned junk food advertising to kids on subways. Just banned it. And that's the type of steps we have to take. We have to be able to say it's the same thing as with things like cigarettes. Putting sugar in your mouth is like smoking a cigarette. I have a very strong stance on sugar, but I think we need to treat it that way and stop the marketing. And I think we can totally reverse engineer. And to say that people can't change their diets is an absolute myth, because people change their diets very quickly. This nutrition transition is watching countries change their diets in a single generation towards junk food. We'll just change it back just as quickly.
Hi. We had this conversation on this table in here. I'd like to know what's your position regarding GM food when it comes to this imbalance that exists in terms of the distribution food across the globe. I'd like to hear your idea on what is happening in EU countries and to what extent you think that is affected by politics rather than science.
Regarding GMOs?
Yes.
Yeah. So, people get so passionate about genetically modified foods, local foods, organic foods, vegan, and it's like they wear these things like an identity. I'm a vegan, or I'm anti-GMO, or it's only about local foods. And we didn't take it, what we said, we didn't bring up any of these within this report. Because the fact of the matter is a lot of people are hungry, too many people are overweight, and we need to feed 2 billion more people. So every option has to be on the table. And in some cases, genetically modified foods actually helps us. If you can genetically modify a food that increases nutrient density in particular foods, like in places like Africa where there is certain issues, why not? If you can genetically modify palm oil so it changes from a highly saturated oil to an unsaturated oil, why not? There are some healthy aspects of genetically modified foods. It's not all bad. Of course, we need to look at the issues and look at it case by case, but we can't automatically say it's bad. Same thing with local food and non-local food. Is local food always good? No. Local food is not always the answer. Sometimes we need to ship things in from other places. Is organic food always the answer? No. So what we're saying is that all options have to be on the table. We need to look at it, and we can't be so I guess polarized in these issues that we automatically shut down conversation. And the EU is a perfect example. I mean, the EU is very anti-GMO. You know, Norway banned palm oil. They were very proud of the fact that they got rid of essentially palm oil in all their products. You know, I worked in Borneo and I've seen the destructive aspects of palm oil, but now they're starting to realize that banning palm oil is not the solution. Banning palm oil will have huge economic implications. It'll put thousands of people out of jobs. It'll lead to more deforestation. So they're finally starting to realize that palm oil has to be part of the solution. You know, and banning it is not the way to go. So I think we also have to be careful about going so far to one extreme and not relying on the evidence that we have here, which is pretty clear. And our decisions have to be evidence-based and not based on passion or emotion. No, we should be passionate about the issues, but not emotion-driven. Yep. Ask anything.
I guess it's kind of, again, related to what you presented, that we have these fortification policies, like of refined grains and, I don't know, juices in Canada, let's say.
Yep.
So in one way, actually, so maybe for a kid or people who just want to eat refined grain, this is the really great way to actually have those kind of policies in the place, yeah? But in the same time, maybe you're actually kind of also advocating for eating more refined grain than whole grain that you're actually, against, I guess, in your report. So what do you think about these policies? Should they still be in the place, and what governments actually should do about this kind of, policies that they have in the place?
Yeah, the fortification of some
Yes.
refined grains actually helps lead to increased nutrient density, or if you're looking at the nutrient composition of a whole diet.
Yeah, because you were talking about the
Yeah.
biofortification. Now it's just like it's another way of fortification. So
And I think this is another one of those issues that we present these global targets, but you really need to look at the local realities that you're living in.
Yeah.
And we were talking about milk consumption earlier, and the new Canada Food Guide that doesn't have any dairy up there. And is that in some particular cases where individuals are not getting the correct composition of nutrients, but milk delivers them in a way that makes sense. So if you take that off the table, is that a good or bad decision? And I think this is a similar case. It's case by case. Eating whole grains is hands down better than eating, refined grains. But if it's at the expense of getting nutrients for certain populations in certain conditions, then I think we need to look at it. So once again, we can't be so dogmatic in terms of like looking at policies and saying yes or no, or looking at this and saying no dairy under certain conditions because certain populations don't have access to the wide range of diverse foods. We don't have access to a Whole Foods where we can each walk into it and buy whatever we want or whatever grocery market that we want. And this can't be considered an elite diet that is only accessible to some people.
Okay, thank you.
Wow, it's really quiet in here. I feel like this is like a defense or something.
Well, thanks for a great presentation. It was really powerful. You said toward the end that part of the challenge moving forward is to make sure that we don't alienate industry. And pursuant to goal number 17, we have to have these multi-level partnerships, and that's absolutely true. What are your thoughts about the flip side, I suppose, of that? How do we overcome industry opposition that reflects business as usual and projected into the future? And how do we ensure that vested industries that bear concentrated costs don't co-opt the processes that we need to engage in terms of coordination going forward?
I don't know. I mean, industry is definitely part of the problem, but they're also part of the solution. And I think I used to be much more. I did not think we should work with industry. I thought industry was really they were the culprits. They were the ones that were causing the problems, and we really need to stay away from them. And I think the new Canada Food Guide is a perfect example of what happens when you keep industry consultation out of it. So there are some positive benefits about it. But I work personally with Burger King and Starbucks and Unilever and Nestle and cruise ships. And the thing about working with industry is, for the most part, the experiences that I've had is they kind of want to do the right thing. It doesn't always mean that they're going to have the economic yields that they want, but a lot of industries actually want to do the right thing. And a lot of businesses do. And I think a lot of businesses are actually starting to see that there's money to be made there. So there are some front runners that are out there actually leading the pack. And the thing with industry is they can move so quickly. I mean, national politics and policies are so hard to change, but industries can change so quickly. It's the same as cities. If you want to change things pretty quickly, work with the city. Don't work with national politicians, because cities can make changes like this. So yeah, I mean, I think we're always going to be faced with vested interest, but I guess when you're talking about industry, I think they see the writing on the wall that this is where we're heading. And some people are going to be front runners, and if they want to make money doing it, I'm all for it. But in terms of the industry influence and the vested interest, I think we're always going to have to be wary of that, but I don't think that means that we should not have them at the table.
No.
Thanks.
What you've been presenting from my take on it is a very scientific way of understanding how we operate. And we were talking just briefly over dessert about the way you frame the top-down versus the bottom-up.
Yep.
And your bottom-up was education, which to me is still top-down, right? So I'm trained more in sociology and that side of things. And when we talk about bottom-up, we're often talking about grassroots organizations, these kinds of things. It's not a campaign of education onto the population. So I would just like to let you address that aspect of this project.
Yeah, we did it. Yeah, I don't know if you guys know Tim Lang. Tim Lang is a very famous policy guy in the UK, and we've talked about this quite a bit. And we need the grassroots movements. Like, we need the grassroots movements out there to mobilize individuals to be able to. And I think that the reason that we need the grassroots movements is to influence policy through voting. And I think that's where the grassroots movements have the connection between the bottom up and the top down. You vote the right people into place, and they're going to change the policies that you want. I'm less of a believer in grassroots movements towards behavioral change, because I think those take a really long time. Not that we shouldn't do them, but we shouldn't rely on them as being the only way to solve the problem, because we don't have time. And I would say if we had a longer period of time to solve these problems, we could rely more on the grassroots movements to solve it. I'm leaning more and more towards the top-down regulatory approaches in terms of solving it, in terms of saying, when you go into a grocery store, if that chunk of meat is so expensive you can't buy it, you won't buy it. But if the fruits and vegetables are so cheap that you will buy it, well, you'll shift to making that choice, not because it's healthier, but because there's an economic aspect to it. When you go into McDonald's and the 99-cent hamburger is now $14, but the veggie burger is 99 cents, you're going to switch to buying the veggie burger. And I think some of those regulatory measures actually pushes down towards a behavioral change. So yes, we need both. But I actually view the grassroots movements more like the Greta Thunberg, the Swedish girl who's taking over the world, or climate change stuff, and she's now influencing policy. She's getting the politicians to spend money on this issue where they never did before. So that's how I personally view it, but we did not address it within this report. I think it'd be a very interesting paper to write, actually, in terms of this top down versus this bottom up, but putting the temporal aspect of time. And when you're faced with 11 years to solve the SDGs, what is the tension between each one of those in terms of solving these problems? And I think there is a tension. Yeah.
Yeah, I just wanted to ask you a little bit, or maybe probe you a little bit about the common comment about we need to feed the world and the 10 billion. And I hear that all the time as a motivator for the status quo. And you're using it as a motivator for change, like why it's so important that we change to the plant-based diet, for example. So just as an example, here in the prairies, we hear, the farmers will repeat that statement back to us, and industry will repeat that statement back, that the reason we're doing these practices is so that we can feed the 9 or 10 billion. And so we're going to just keep doing what we're doing. And yet, you're giving a different message or urgency towards that 10 billion. So I just thought I'd probe you on your thoughts about how do we use that 10 billion? I mean, my comment has always been back that, the world is not going to be surviving on canola. Like, that's a cash crop. That's why you're doing it, but that isn't what's going to feed the world. So
Do you feel like we shouldn't be thinking about that it's our responsibility to feed the 10 billion, or?
yeah, maybe, okay. Yeah, I don't think that works. I actually think that industry has already grabbed that one, frankly, and perverted it in a way that's got a different message that I don't think is positive for the most part. So, but I heard it different from you, which is really refreshing, frankly, but it's not it's not what I hear from the farmers that I work with, and it's not what I actually even hear from industry, and even policymakers are using it to support that sort of dogma, like we need to keep doing these intensive agricultural practices.
Okay. Yeah. I see this. So if you look at the SDGs, the great thing about the SDGs is the fact that the equity is inherent in all these SDGs. Is the fact that we're not just going to do it for certain parts of the world, we're going to do it for absolutely every single person on this planet has the right to no poverty, zero hunger, good health and well-being, and all the way across. So I come at it from the fact of, if we're going to achieve this, if we take this seriously, and it's not just a bunch of prayer flags up there in the ceiling, that inherently we have to consider all 10 billion people that we have on the planet. We are co-citizens of this planet. We inhabit this planet together. Planetary health is the health of all of us and the environmental systems upon which we depend. What we didn't say up here, though, is let's feed everybody a healthy diet and to hell with the world that we live in. That's not what we said. We said, let's feed everybody on with this diet, but do it within the environmental limits that we have. And I think that's the key message here, is we need to achieve zero hunger, but also be thinking about climate action and life below water and life on land and everything else. If we're only thinking about zero hunger, then that's way too narrow of a focus. So if you have farmers coming through and saying, fine, I'm gonna destroy the land so I can feed everybody, that's absolutely the wrong message if we're thinking about planetary health. We cannot think of the two agendas as being separate any longer. Those days are absolutely gone. We have to think about them integrated. What happens to one happens to the other. If you mess up the environment, it doesn't matter if you achieve good health for everybody. It doesn't matter because we're ultimately going to lose. Anyway, so I mean, if farmers are using it, and if industry is using that, then there needs to be a serious concerted effort in terms of getting them to think more along the integrated health environment agenda and not separating those two into the silos that they normally are. And one of the key things that we have to start shifting with industry is industry can say whatever they want. Yeah, healthy and sustainable, and I'm achieving this target and this target, but we have to hold them accountable to numbers. And the reason that we worked so hard to putting numbers up here in this diet is it holds everybody accountable to these numbers. We have to feed everybody these foods at this amount within these environmental targets. Then we work with industry and we say, what does that mean for your industry? What is your allocated amount of greenhouse gas of like greenhouse gas emissions that you can put out there, of water that you can use, if we're going to stay within these limits. And by allocating certain numbers to industry that stays within these targets, you hold them, accountable. Without having numbers, industry can say whatever they want. And the great thing about the Paris Climate Agreement is we're now holding every single industry and government on the planet accountable to numbers. Just saying we have 800 gigatons left. What does that mean for my industry, for my particular country? And it works. But without numbers, we can say whatever.
So we're standing on land that was once like covered by vast, grasslands, right? And roamed by massive herds of bison. And I think from what I understand, Africa is there's still, just agricultural intensification hasn't quite happened there, and there's still quite a lot of grasslands and giant herds of herbivores. But one of the last figures you showed was sort of how we want to move towards more productivity out of Africa. So I'm just wondering, recognizing that species extinction was a limitation you did account for, but is it possible to, increase agricultural production in Africa, without compromising the environment like we have here in North America? And I'm also curious to hear from, I'm noticing it appears like African people and Indigenous people. I'm curious to hear from these voices as well, what their thoughts are.
Yeah, please. Let's make this a conversation, and if anybody doesn't agree with something I'm saying or has a different opinion, please feel free to chime in. I mean, we can absolutely increase production in Africa because our target for land use is zero land expansion. So the land that's already devoted to agriculture production in Africa, it's already there. The trees have already been cut, the land has already been converted. We just need to produce better on that particular land. We shouldn't be converting places like the Serengeti and chopping down places like the Congo. No, absolutely not. We need to do with what we have, right? So all we're saying is we've got this land. It's already been converted. The trees have already been cut. We're already producing food to some extent on it. We just have to do it better. And if we increase efficiency up to 75% and do better with water and other things, we can actually feed most of the people on this planet by doing it. So efficiency is a huge key.
The message today was very nice. It's about food security and sustainability. So I'm thinking how we can send this message that everybody can start to use it. So I'm thinking that the one strategy, it may be to just educate the teachers, professors, and then can they educate children, students, and parents so that the message can be heard. Then, of course, if you change the behavior, industry will not have, it will respond to the demand of the society, so it will be kind of change. So I'm thinking that the main point maybe should be put on education, to change or to apply this to apply this project. It's needed to be involved in education from 1 year to 80 years.
Yeah, I mean, I think education has to be part of the solution. I don't think that we need to rely only on education. We've had a lot of conversations about communication. How do we communicate this in a way that works? And we have to make this topic, I use the word sexy a lot, but it's true. I mean, the thing about EAT, we work really hard and we play really hard. We have fun doing what we do. And when we're going out and doing this stuff and we put on the EAT forum, it's extremely different. And I think that if we're going to educate it, if we're going to get the message out there, we have to do it in the way which is vastly different than what we've done in the past. We have to learn from the Cokes and the McDonald's and really look at how they've been educating the young kids today and do the exact same things. SDGs, how do we get this message out to all the people on campus? Get it up on televisions, get it up, in bathrooms, get it up everywhere so everybody sees this message. There are things that we can do that will have a huge impact. So I think when we think of education, we can think about schools, but I think we have to also think more broadly and creatively in terms of what connects with people. And how do we make this cool and something that people want to do?
Thank you. Talking about sexy, people don't like to talk about toilets also, And that isn't sexy also. I used to work in wash sector, so my two comments. One is you showed for different continents how it looks like by percent of their food contains. It'll be interesting to see by income level how it looks like for people, the different structure of protein, fat, and those kind of things. That will be interesting to see. Because within those continents, because of income level and because of the number of population varies from continent to continent, that will be an interesting thing to see. That's one, if you have any thoughts on that. The other thing, you talked about changing policies. So for example, if take for Bangladesh, if you increase the price of meat by, let's say, 20 cents, there can be a riot.
Yep.
So do you have any examples those policies have worked in developing or mid-income countries when you try to change behavior through economics, and it works?
Yes. So we need to do a stern review for the food system. That has to happen, and it's actually in the works. It's being discussed that the next step is that we're going to do a major stern review in terms of the economics of inaction, because what people listen to are health and economics, and those are the two main drivers. And we might care about the environment, but a lot of people don't. But they do care about money and they do care about health. So if we can crack those two, we got the health element kind of cracked, but we don't have the economics. So doing something like that is absolutely key. And it's not only by continent, it's by nation, and it's by city. It's by family. Even within the same family, you'll have some people that have vastly different nutritional profiles. So the scale of this is we've got to figure that out. And your second question was, second part was...
Well, the policy implication with economics and changing behavior. You talked about imposing, in certain ways imposing the policy change and then imposing the behavioral change, right? So we are talking about, for example, in North America, because of education rate and certain consciousness, that's easy. But when it comes to mass population, in countries like Bangladesh, China, India, those kind of places.
Oh, yeah.
So if you
sugar
have...
tax in Mexico.
Okay.
If you look at the sugar tax in Mexico, that's had a very positive impact. And when you look at they're just now starting to get some of the data back from that, and they're realizing that it is actually bringing down consumption of sugar-sweetened beverages. So there are actually, and there are other places like Chile, which are thinking about imposing taxes on unhealthy foods. So there are examples where this is actually happening.
You want? I'm interested in food sovereignty, and I know you mentioned the idea that we don't want to be like sovereign nations with our food, but there are groups that do focus on having like the food sovereignty aspect and small-scale farmers. So if you're talking about South America or indigenous food sovereignty, that sort of thing, was any of that factored into this particular report, or any other that sort of level of groups?
A bit. And if you look at the modeling implications of it, that complicated chart with all the colors, if you look at the biodiversity, you'll actually see that in some cases adopting the planetary health diet led to an increase in biodiversity loss. And the reason is what ends up happening is that we assume that for those particular cases, individual countries will produce more vegetable and fruits, increase their consumption up to 2,500 kilocalories, and the only way to do that is to cut down their trees, which is next to them. So you get Madagascar, They're gonna cut down their resources that they have to produce this diet if they're not relying on trade. So in many cases, what the models are showing is that if we focus on food sovereignty, well, food sovereignty versus food security, I guess they're a bit different issues. But if every nation should have access to food, sovereignty. But if you're talking about food security, and you're talking about from a national perspective, nations can't do it.
No.
Like, we can't farm ourselves out of this problem by looking inward. The problem is we need to figure out how to not weaponize food like we have in the past, because some nations are going to rely on food, and if we're holding nations hostage for this food, it leads to wars and it leads to riots. So it's a tricky issue. The carrying capacity of the planet can actually be increased if we cooperate more. But we're talking about governance. I think we're talking about before. That's one of the most important things that we need to figure out how to do.
Did you want to ask your question on? What was my question? Tracy had a question on factoring in the climate change. So the projected impacts of climate change, and when when we're looking at what sort of food we need to produce, we're going to be producing that food in a more chaotic atmosphere of storms and that sort of thing. So those were factored in as well to this report?
No. Because in this report, we assume that we achieved the Paris Agreement. So we assume that the world does its job and achieves the Paris Climate Agreement. If the world doesn't do its job and achieve Paris, and if we're shooting for 3 or 4 degree increases, this is going to become irrelevant very quickly. So it has to happen.
Okay. Is there one more question from the audience? Yeah, sure. Whilst we would like to stay here all night, I do want to be respectful of the chef and his team. They have to clear up and clean up, and we're going to be back in here tomorrow, so this will be the last question.
Thank you very much. I'm Juliana, and I want to actually find out what next. Like, what is your implementation plan now that we found out all these strategies? Because I'm from Uganda, and we find that in the central region, for example, you can have high production or you have food losses. For example, foods get wasted or lost. However, in the northern region, there is food insecurity, don't have food, but it's just the same country. So you find that there are discrepancies just because of policies, of politics, of imports, of taxes. There's so much more than just income. Yep. So I'm wondering what next, what are your implementation strategies of these 3 different goals of a planetary health, increment of production, as well as reduction of food waste?
This is a great question to end on. Implementation. Get you guys to solve the problem. Get your planetary health team together and solve it. Absolutely. I mean, how many reports are written? You do these great reports. People love it, and then they collect dust and they use them as doorstops. They sit on a shelf and they don't go anywhere. So we've set global targets. But the next step that has to happen is, what does it mean for each country? What does it mean for Uganda? What does it mean for Canada? What does it mean for my particular city? So the next thing that has to happen, and it's already happening, is translating these global targets into tangible targets that make sense to individual cities, nations, businesses, in the various contexts. So that translation of these global targets into individual targets, the science-based targets, has to be happening. We've got a couple pilot projects. So I'm working on a pilot project with businesses right now where we're actually translating these targets right now. We're working with pilot countries. We're working with Ethiopia, Colombia, Indonesia, Mexico, Sweden. I think those are the 4 or 5 countries that we're piloting this particular right now in terms of what are the large policy implications that have to be put in place to actually implement this in that particular country. And we have large modeling teams that are actually setting out there to do that. So without actually translating this into something that makes sense for the individual country, it's never going to go anywhere. So the next step is already happening, but this next step is all hands on deck, man. This is everybody has to do their job and figure out how we do this. So I think, for what this means here is you need to figure out what your own piece of the pie is, what the issues are that are important to this community. And then you need to say, well, now we have targets. right here, how do we translate those into something that makes sense for Canadian businesses, for Canadian cities, for the province, or for, whoever? We can translate some of these if we want, but without those quantified numbers, which we finally have, we have to make them context specific. So that's the implementation step that has to happen. And there's a lot of cool examples out there, and I'm happy to share some with you. So
Let's give a big round of applause.